By now, many of you have heard about this. Brooke Shields gave an interview to Allure where she described her experience of going in for a labiaplasty and leaving with an additional vaginal rejuvenation. Shocking, is it not? I was shocked when I read this, but then I actually stopped and thought back, wait a minute, even during my training, I remember seeing times and moments when physicians would do a little something extra thinking it was going to be for their benefit. In particular, after having had a baby delivered, there's a tear, you're supposed to repair the tear, and then there'd be that age-old comment of, I'm going to throw an extra stitch in there for your husband. Completely inappropriate and unacceptable. As I understand it, what happened to Brooke Shields equates to assault, where she consented to one procedure and ended up having more than that one procedure performed on her. And as I understand it as well from the article, she is not pursuing any legal ramifications at this time. As a surgeon, you go through your informed consent with your patient, and you actually legally need to make sure you're doing the right thing to the right person. I can't then decide during the procedure that I'm going to go ahead and add something you didn't ask for. Let's say you go in for having a breast augmentation. I would not then just go in and do a lift without having consented you for that procedure, explaining the risks, the benefits, and the alternatives. So one thing that came out of this article that I want to go through with you is the fact that there's a little bit of a lack of knowledge as to what vaginal rejuvenation is. We can't tell from the article whether he performed a surgical procedure to tighten her vagina or had a non-surgical, typically a laser procedure done. And that's because it just says vaginal rejuvenation. So if you want to hear about what all is involved with vaginal rejuvenation, go ahead and head to part 2.